As reported by the CDC and others, student mental health concerns are reaching crisis levels. Schools and teachers need to be able to spot the warning signs of a mental health challenge. Today, in collaboration with the Pennsylvania Office of Mental Health and Substance Abuse Services, we will share some common warning signs for a mental health challenge, as well as for someone at risk for suicide. At the end of the video, Dr. Perry Rosen will share some tips for supporting students in a mental health challenge. Let's get started in today's pop-up practice. Mental health is something that affects all of us. It requires knowledge and effort to maintain positive mental health. Mental health challenges are common among youth, and before the pandemic, approximately 1 in 5 students had a diagnosable mental health condition. Concerns about mental health challenges and suicide risk among students have continued to increase in recent years. A survey conducted by the CDC in 2021 reported that 44% of students surveyed experienced persistent feelings of sadness or hopelessness, while 1 in 5 reported seriously considering suicide, and almost 1 in 10 attempted suicide in 2020. Being able to recognize and respond to warning signs connected to mental health challenges is a crucial skill for all who work with youth. While only a mental health professional can make a diagnosis, it is important for other professionals to be aware of the warning signs of a mental health challenge. Here are some of the most significant warning signs. Feeling really sad or withdrawn for more than 2 weeks. Drastic changes in mood, behavior, personality, or sleeping habits. Extreme difficulty concentrating or staying still. Intense worries or fears that get in the way of daily activities. Really concerning risk-taking behaviors or acting out of control. Sudden, overwhelming fear without reason. Not eating, throwing up, or experiencing significant weight change. Repeated, frequent use of drugs or alcohol. And seeing, hearing, or believing things that aren't real. Unlike risk factors that we can't always see or may not be known to us, these are the more observable indicators that suggest some sort of change in behavior from what is typical for the student. We know that the average time between the onset of symptoms and the start of an intervention can be between 8 to 10 years for someone with a mental health challenge. So knowing and recognizing these signs can play a key role in helping students receive support more quickly. Others, particularly students, may not be well informed or have the insight or knowledge about mental health to recognize there may be a problem. They might think, this is just me. This is just how I am. As adults, when we have this information, and when we also teach it to our students, we are expanding that safety net for others to know what to look for and when to reach out. This list is not exhaustive, and sometimes these can be challenging to observe directly, or will look different for different students, which is why having conversations is so important. It's never too soon to start a conversation about mental health. When talking about suicide, there are empirically derived, observable warning signs that may indicate that a young person is seriously considering taking their life. While the mental health warning signs we just discussed may not all signify crisis, these warning signs for suicide do require immediate action. The first warning sign for suicide is talking about or making plans for suicide. This can be direct statements such as, I want to kill myself, or indirect statements such as, I just want out, I'm done with this. Making plans may mean that someone has researched a method or searched online for ways to die. The second warning sign is expressing hopelessness about the future. Hopelessness can look a number of ways, from something a youth may say, such as, things are never going to get better, to showing changes in appearance. For example, someone who usually cares what they look like, who starts ignoring their hygiene and their appearance. Another warning sign is showing severe or overwhelming emotional pain or distress. This may look a number of different ways, but it is clearly visible to others around them, especially those that know them well. Lastly, a warning sign for suicide can be other behavioral indicators that would be considered worrisome, particularly in the presence of the other warning signs above. Specifically, this includes significant withdrawal from or changing in social connections and situations, a recent increased agitation or irritability, anger or hostility that seems out of character or out of context, and significant changes in sleep, whether sleeping more or sleeping less. It is really important to take these warning signs seriously, no matter how many times they have been observed before. As parents, educators, and community members, We don't have to assess a young person's risk, but should know what to look out for to be able to offer support and seek additional help. In general, these are changes from how that youth typically acts. It is important to note that these are warning signs that may indicate that someone is thinking about suicide, but there could also be something else going on. So the best way to find out how to help is to have a conversation.
Because of the relationships we have with students, they may come to us directly if they're struggling with something, including their mental health. Other times, you may notice a change or one of those warning signs for mental health challenges or suicide risk and wonder how to connect with your student in a way that's helpful. Reaching out and having a supportive conversation is actually a really powerful intervention that can reinforce connectedness and help a struggling student connect with resources that they may need. In starting a conversation, it's always helpful to begin by expressing your concern, which could be something as simple as, "I'm concerned about you. Are you okay?" Or you can mention what has you concerned, saying something like, "I noticed that you've been sleeping in class a lot, and that's not like you. Is everything okay?" As much as possible, try to ask open-ended questions that encourage your students to talk and share how they feel, as opposed to just providing yes/no answers. For instance, you could ask, "How's everything been going for you lately?" Third, we want to listen more than we speak. As adults, we tend to jump in too soon, often to provide solutions before the student has had the chance to share what they've been thinking or feeling. Next, whatever our students are going through, we want to validate their emotions and also normalize these emotions when we can. Even if you see those feelings as extreme for the situation, they're still how your student may be feeling. We could say something like, "That sounds really hard," or "It's understandable that you would feel frustrated or upset given what you've shared." Know that it's okay to be vulnerable, but we do want to limit personal sharing in these conversations and keep the conversation focused on them as much as possible. In offering support and hope, we don't want to be dismissive or say something like, "Don't worry, you'll feel better soon," because we can't control that and we don't know whether that's true. However, we do want to let our students know that help is available, and we want to let them know that we're there for them and that they're not alone in what they're going through. Lastly, we have to refer the student as needed, which means we do need to know our school protocols in terms of who to refer the student to and how to do so. In many schools, this is going to be a school mental health professional, such as a school counselor, a school psychologist, or a school social worker. If the student mentions suicide, or you notice a warning sign for suicide and have concerns that the student may be thinking about this, know that one of the best things you can do is ask them directly. Are you thinking about suicide? Or have you had thoughts of killing yourself? Just know that this is not going to put the idea in a student's head if it's not something they're already thinking about. And that's often a fear that we have that prevents us from asking this question. With regard to resources, you always want to make sure you know who to go to or what resources to share before you start this conversation. Because if the student says yes, or if they say maybe, or I don't know, you're going to need to make a referral. As a final point, there are a variety of reasons, including cultural reasons, that may impact a student's willingness and comfort to share. But don't let this stop you from reaching out and making that connection. If the student isn't ready to talk, it's okay to let them know that you're here if and when they are. And if you continue to have concerns, even without having a conversation, remember that you should always make that referral. Also, there may be some times and circumstances where you don't feel comfortable having the conversation with a student. That is also okay. But just know that if you have concerns, or if a student attempts to talk to you about something that's happened and you don't feel prepared to have that conversation, don't just let it go. Be sure to make that referral to someone at the school who can reach out to that student and have that conversation.
Thanks for watching. We hope you found the information shared helpful in your work supporting students with mental health challenges. For more information, be sure to check out the links in the description. Thanks again, and remember, practice makes progress.